In this pilot, the patient is really the driver. They're going to make the decision. Nurses are going to introduce. Typically, a nurse will come in and explain how to use the equipment, what kind of experience they're going to have, and help them through it. Once they get comfortable with it, we've worked very hard to make it very easy for the patient to drive it themselves. And what we see, in general, is that people don't want to take drugs. People want to be clear-headed. They want to be able to interact with their family. They want to be aware. They want to enjoy life. And the underlying thing about drugs is that narcotics actually dull our experience of life. In fact, let me share with you, there's a study that used Snow World. So we built an application called Snow World, used with burn patients. We did this with the University of Washington and Harborview Medical Center in Seattle. One study that compared 4 conditions. The same patient with no treatment control, patient gets opioids, patient gets VR, and the patient gets VR plus opioids. If you look at, just comparing the no treatment control to VR and opioids, what you find is that actually on a number of dimensions, people, so number one, VR did very well in this comparison. VR actually outperformed, in this study, it outperformed opioids by significant amounts. What's interesting is that sometimes the experience with opioids was actually worse than the no treatment control. People they spent more time catastrophizing. They spent more time just feeling kind of, their reports about the levels of pain and kind of the amount of enjoyment that they're having in this experience. It was worse. So I think the bottom line is that opioids are great for a lot of different uses. I don't think that we're going to stop using drugs, but I think that we need to look very clearly about what they can do and what they don't do. And if I take a drug, it's in my system until it's gone. The cool thing about VR is that I can turn it on and I can turn it off. And maybe I just need to get through, I have chronic pain, I'm at work, I just need a breather. I just need a break. I don't want to drug myself out because I got a big meeting this afternoon. I just need to get into a better headspace and be more mindful and relax. And that's the kind of thing that VR can do. We can turn it on, we can turn it off. And that's something you can't do with drugs.